like to try to get back to. And so hopefully I can share with you some of these issues that, number one, are reversible, so they're very, they can be treated if you address them correctly, and they come up very commonly and often can reoccur. So hopefully it's something that once you learn how to treat and can recognize the symptoms, you can do what is best for you to try to help make sure that you keep those symptoms under control. We will be doing some question and answer by the end of the presentation. So hopefully if you can think about your question, and if you have that at the end, you are more than welcome to ask any kind of questions. I love to be able to engage and, like I said, educate. So feel free to ask anything and everything that you may have a question about. So let's get started. Like Dr. Stefan said, we're talking about lateral epicondylitis, and for those of you that may not know, that is the medical term for tennis elbow. Don't worry, for those golfers out there, I will be talking about golfer's elbow as well. I think I'm just going to hit this one off so that we don't get interference. Tendonitis, which is a general term. A lot of you may have been diagnosed or heard the term tendonitis, and you may not exactly know what it entails, so we'll go through that. And then also know that tendonitis can really affect many different parts and tendons in the body. So I'm going to talk a little bit about the shoulder, the rotator cuff tendonitis, and hopefully you all received a brochure on your way in. Feel free to kind of read along, and some of that is in my presentation, but I also will go through some of the other more specific golf and tennis issues as well. And then bursitis, which a lot of people are diagnosed with and no one knows what it is. So I'm going to go through and educate you, hopefully, if you've ever been diagnosed with bursitis. All right, so again, we're talking about the soft tissue injuries of the muscles, tendons, and ligaments. And I want to go through a little bit of a rough background first, kind of more of the general information that you should know before we get into the specifics. So strains and sprains are two very common soft tissue injuries, and strains, as you can see with the T, means that that's an injury to the muscle tendon unit, and that occurs when a structure lacks flexibility, strength, or endurance to accommodate the demands placed on it. If you hurt a thigh muscle, you have probably strained that muscle. It occurs to the muscle tendon unit. A sprain, on the other hand, with the P, means that that's an injury to the ligament, and that results in laxity of the joint. If you've ever had an ankle sprain, then you have injured the ligaments of the ankle, and there's many specific ligaments that you could have injured, but you treat them differently. There are classifications of sprains and strains. They're both categorized as mild, moderate, or severe. A mild or a first degree sprain or strain would mean that only a few fibers are torn. Again, that will be the muscle or the ligament fibers, and that means less than 10%. If you have a moderate or a second degree sprain or strain, that is very general. That's a wide severity range, meaning that anywhere between 10 to 99% of the muscle fibers or the ligament fibers are torn. And then third would be a complete rupture, and that's a very severe sprain or strain. Sometimes that requires surgery, sometimes that does not. Okay? But those would be the classifications. So if you know that you've been diagnosed with a certain level, that will affect your healing times and your treatment recovery. Ultimately, the general goals of any soft tissue injury is to minimize the adverse inflammatory reaction. We've all heard about inflammation, and inflammation is very bad for the body. So anytime that you have an inflammatory reaction, we need to try to minimize that. We try to prevent adhesions to the capsule and joint, and capsules are basically surrounding your joints. It's a thick bunch of ligaments that help hold a joint nice and stable. And then the last goal is really to try to heal with normal mechanical force to return to normal function. If you heal with the absence of a normal mechanical force, with the absence of a normal mechanical force influence, that leads to poor tensile strength and ultimately a chronic state, meaning that the injury can occur over and over and you never heal properly, always leading you to have some signs and symptoms of the initial injury. Can everyone hear me okay? Am I doing okay? Okay, just let me know. All right, so again, this is all just kind of the general background, because with these common injuries, there is an underlying theme of the way that we try to treat them and the way to really try to avoid getting to that chronic state. So a circle of pain and dysfunction is often described as being responsible for preventing an initial injury to heal and thus perpetuates this circle. So the initial injury and inflammation occurs. Okay, we've all had that. If you're out, playing tennis and you feel a little tweak in your elbow, the initial injury has occurred. Then you feel pain, and that is a warning sign to your body. Something has happened and it's out of the norm. Pain is a good thing. It's a warning sign to your body. Okay? When the pain cycle lasts for too long is when it becomes a problem. So after you've had that pain, then you tend to get into that pattern of disuse. You try to favor your arm, you stop using it for a little bit, okay? But if you do that for too long, that leads to atrophy and fibrosis. Atrophy meaning basically a weakening of the muscle, an actual shrinkage of the size of the muscle fibers, okay? And fibrosis would be a thickening of the tendon or the ligaments. Okay, then you lead that, because of the thickening and the loss of the fibrosis, you basically lead to a loss of flexibility, which is not good because that leads to contracture, meaning that the muscle or tendon has basically stayed in a shortened state. Okay? That weakness and altered function then leads to decreased performance. And then the whole thing cycles back again, because if you go out and try to swing your tennis racket, you're going to have decreased performance and alter your mechanics, and then recycle back to inflammation and injury. Okay? So the most important part is that chronic tendonitis may actually lead to weakening of the tendon and its eventual rupture. Okay? And so for a lot of people, especially as they are aging, and if their tendons are naturally becoming a little more fibrotic, you have to be even more careful that you're avoiding some initial tendonitis so that you don't weaken your tendon more and get a tear of the tendon. Okay? All right. As far as the healing stages, there's 3 stages. Everything seems to be in 3s here. We have the inflammation stage, also known as the acute stage. We have the healing stage, which is a subacute stage. That's the 2nd stage. And then the 3rd stage would be your maturation and remodeling stage. And that is really ultimately that chronic stage. Okay? What we want to try to do, as far as knowing the proper healing, we have to remember how the structures heal. Muscles, since they have the best vascular supply, they will heal the quickest. Then tendons, then ligaments. Okay? Muscles typically, it can be anywhere from 2 to 3 weeks up to about 5 or 6 weeks. Big muscle groups will take a little bit longer to heal. Okay? If you've ever seen, the professional football players when they're out with a hamstring, pulled hamstring, a hamstring strain, or a groin strain, those typically can take about 6 weeks. And so sometimes they rush them along, and then that leads to the chronic, not full healing. But really the total repair time after an injury depends on the density of the connective tissue and the amount of circulation to the tissue. If you're a person that doesn't have very good circulation, it can take even longer. So knowing some of those, again, kind of the framework of how the structures heal and that vascular supply can affect your healing. Okay, so inflammation stage, I'm just going to briefly touch on these because, again, these would hopefully be things that you recognize if you are out on your own and you injured yourself and you're in the inflammation stage. You need to know that that starts immediately following the injury. So basically between 24 and 48 hours, all the way up to about 6 to 7 days is considered the inflammation stage. Okay? This is the first stage of repair when pain is encountered. Swelling, redness, heat, and loss of function may all be experienced. And I'm sure everyone in this room has experienced an inflammatory condition or inflammatory reaction of some sort, and hopefully you are able to move out beyond that stage. But this is normal when you have an injury. It's a natural part of the body's healing process. And what we need to do, like I had said previously, is we need to minimize the effects of that harmful inflammation lasting for too long. Okay? Our goals during the acute stage, and this would be hopefully your goal if you are taking care of your injury on your own, was that you control your pain, your inflammation, and your muscle guarding. It's important you protect yourself from further injury by reducing your activity. And this is one of the hardest things for people to do, is to hold off. You need to actually stop yourself from participating in the harmful activity. So everyone kind of tries to push themselves a little bit, but if you're trying to really help yourself heal, you do need to, for that period of the inflammation stage, which again could be 2 days up to 6 days, try to at least back off and scale back your activity. You need to promote the biological healing and the proper dosage of movement within pain tolerance. So pain really needs to be your guide. Remember, pain is a good thing. It's a warning sign. So let pain be your guide and do movement within pain tolerance. Okay? Which again, everyone asks, well, what is the tolerance? That is individual for every person. But I always use a guideline, it should never be bringing you to tears. So if an activity feels like it's bringing you to tears, then that's not within your tolerance. And then we, again, try to prevent the loss of muscle strength and atrophy. And sometimes that just means making sure the rest of your body is still staying conditioned, even though you're protecting what is initially injured. Okay, the healing and repair stage, which is actually going to be from days 4 to 7 up to about 14 to 21 days following the injury. So now we're looking at about weeks, again, kind of 1.5 to 3, almost 3 weeks, again, depending on the structure. This is a stage that may last up to 6 weeks, like we talked about for tissues with slower metabolic rates. Okay, your ligaments, things that are made up of collagen. Remember, those are going to heal slower than muscles. Muscles have the best vascular supply. Your inflammatory signs begin to disappear. You may not have that big ball of swelling. You may not have that warmth to the touch anymore. May not have any redness. But you still have pain if you encounter resistance with the tissue. So if you go out and you try to swing your tennis racket and you still encounter pain with that resistance, you're still in this healing repair stage. You're not at 100%. So again, we will talk about now basically the goals of what we need to do to get beyond that. I like this quote. This is from a study, Kisner and Colby. It's very important that the new connective tissue is very fragile and easily ruptured if overstressed. Yet, proper growth and alignment can be stimulated by the appropriate tensile loading in the line of normal stresses for that tissue. At the same time, adherence to surrounding tissues can be minimized. So basically, that's just kind of a wordy way of saying that, again, you're healing, you're repairing, so it's that balance of trying not to overstress a very fragile connective tissue or the new tissue that's repairing. Our bodies are very miraculous in the sense that they can repair themselves when it comes to soft tissue injuries to an extent. But at the same time, you need to apply the appropriate tensile loading in line of normal stresses. And that's one of the things that actually physical therapy as a profession, we are well educated in how you apply those appropriate stresses in a manner that's safe and effective to return to normal function. Okay, our goals during this middle kind of phase is that we continue all the goals from the acute stage. Okay, we're trying to decrease inflammation, trying to protect the structure, but we also add controlled rehabilitation aimed at restoring both our range of motion and our strength. If we lose the flexibility and you start to develop contracture, and if you lose the muscle strength and the muscle begins to atrophy, then you're again heading down that lower part of the cycle of dysfunction and setting yourself up to not heal properly. So again, rehabilitation, this might be a good point if you end up visiting a physician at this time to get a diagnosis or see what's going on. That may be an option of when you would begin some physical therapy. Okay, and finally, the last stage, which is the maturation and remodeling stage, that occurs approximately 14 to 21 days following the injury. There are no more signs of inflammation. That stage is gone, and you're moved beyond that. Okay, but this is the most important stage because this is really your rehabilitation stage. You need to return to normal range of motion, normal strength, and normal function. Now, a lot of you might be saying, what's normal? You're not sure what normal is. But for one, that's what a physical therapist can help you to identify. We know what the normal numbers should be for range of motion, for strength. Your function, a lot of times, is just based on, can you do what you previously could do? Are you at the same level? If you're not, then you're probably compromising in some way your function, and then, again, kind of setting yourself up for that circle of dysfunction. You still try to continue to promote healing and protect the injury as necessary. So this is now taken on about time frame-wise about a month, okay? And that's for more of a low-grade level strain or sprain. So time, unfortunately, you can't speed up when it comes to healing, and that's really the number one thing, is making sure you address it in the appropriate stages. Okay, so kind of getting back to our topic here. Tendonitis, which is, again, just a general term, and then there are specific forms of tendonitis. Rotator cuff tendonitis, Achilles tendonitis. In your brochure, you have a couple lists of a couple forms of those tendonitis. This occurs as the result of micro tears of the tendon. The causative factors are excessive loading, excessive friction, or trauma. That's usually what brings on a tendonitis. Typically, it's due to the repetitive trauma, as seen commonly with the tendonitis of the rotator cuff of the shoulder. Unfortunately, sporting activities like tennis, overhead serving, or if you continue your forehands, backhands, when you're doing a repetitive motion in pretty much the same way, that can lead to the repetitive trauma. There are 7 stages of tendonitis, and this occurs with progression over time. And I like to educate people on these stages because a lot of times they don't really know how far along are they with their tendonitis and what to expect. So just like the other soft tissue injuries we're talking about, there's always different grades of it. The first stage is when you get stiffness or mild soreness after an activity. You go out and you play tennis, and then that day, the next day, you feel a little bit of stiffness and some mild soreness, and this seems to come up every time that you do that same activity. You would probably be in stage 1, but if the pain relieves without any interventions after 24 hours, that's the first stage. Okay, with time, that could progress to stage 2, which is a stiffness or mild soreness before the activity, but it's relieved by warming up. You don't have symptoms during the activity, but you do have symptoms after the activity that last up to 48 hours. So if you are going to go out and play your tennis match, you decide this time to try to be good and stretch and warm up a little bit, and that relieves that little ache you went into the match playing. And then you go out, you play your match, you don't feel bothered by it, you're thinking, oh, this is really good, I'm doing good, but then afterwards you still feel it again, and it lasts up to 48 hours. Chances are you may have a little bit of tendonitis if that's the case. The next stage, stage 3, would be, again, stiffness or mild soreness before the activity that's only partially relieved by the warm-up. So now you can't really fully get rid of those symptoms. You have minimal pain during the activity, okay, and you have symptoms after. So as you can see with the progression, it's starting to get a little bit more bothersome, and you just can't fully get rid of it. Stage 4 is the same as stage 3. You have pain during the activity, which is severe enough for you now to alter your activity or work, okay? During a tennis match, some people will actually change their form, or they'll try to compromise to try to still do the activity they want to do, but they have to alter their activity because of that pain. You also get mild pain during your activities of daily living. So now you're out trying to lift your bag of groceries and you're feeling that same pain again. So it's not only disrupting some of your initial activity, but now it's starting to affect your daily activities. Stage 5 is significant pain before, during, and after the activity. You need to alter the activity. You have pain during your ADLs, which is very similar to stage 4, but it's just, again, more of a progression. And then the last 2 stages would be stage 6. Now you have pain even at rest. So you're sitting there, you really haven't done much today, but you're still now feeling that little bit of soreness and that pain. Your pain disrupts your activities of daily living. And then lastly, that can lead to pain at night. When your sleep is disrupted, the pain becomes very aching in nature. That's one of the biggest describers of pain, is an aching pain for tendonitis, and it increases with activity. Okay? So those are the progressions of tendonitis. The sooner you can treat it and kind of disrupt that from progressing to the next stage, the better. But unfortunately, sometimes you can't always, and you may be dealing right now at a stage 6 or 7 tendonitis. Okay? So let's quickly talk about rotator cuff tendonitis. These are some of the signs and symptoms, and in your brochure, I think I actually have talked about a full-blown tear in the brochure, but this would be the progressions of the tendonitis. So you might have a decrease in your shoulder range of motion. You have a painful arc between 60 and 120 degrees during active shoulder elevation, which is flexion, bringing the arm forward, or abduction, which means the arm out to the side. So 60 to 120 degrees. This is 90 degrees. This is 90 degrees. 60 might be starting just below that, up to about 120, and that's known as a painful arc. Okay? That would be indicative of more of a rotator cuff possible tendonitis. Sometimes you have pain and weakness with resisted abduction. If I were to resist someone's shoulder, they might feel pain with that motion. And then you might have pain associated with the specific overhead activities, throwing, swimming, serving a tennis ball. The overhead motions aren't the most comfortable. Okay, the treatment for this is hopefully, again, we want to treat tendonitis so it doesn't lead to an eventual tear, would be the number one thing, which is the hardest for people, the appropriate rest and the education on the avoidance of activities aggravating the condition and basically protecting against further injuries. It's a very key element because if you don't allow that appropriate rest, you're just going to skyrocket through the rest of those stages and never allow that inflammation stage, the proper healing through the rest of the stages. We would try to improve the glenohumeral joint capsular mobility if needed, or we would identify if there was hypermobility if present. And again, this would be something that the physical therapist could help you to do. We would look at how the joint is moving and determine if it's too stiff, if it's not moving well enough, or maybe it is too lax and you don't have enough support and you need more stability. Posture is very important to improve. We do a lot of education on posture. And then a proper rotator cuff strengthening program, which again, there are some specific exercises for the rotator cuff that are very, very important to include in your program. And that is something that if you weren't sure of yourself what to do, you would come and get instructed in that, be taught how to do the exercises so you're doing them appropriately, and then be able to carry that out on your own. And then lastly, addressing the scapulothoracic musculature, which is mainly your upper back and kind of scapular shoulder blade muscles for weakness and coordination. Anytime you're doing an activity with your shoulder, if you don't have appropriate thoracic and scapular strength, then you're setting your shoulder up for injury. You need to incorporate the whole upper body to help support that. Yes, sir. It could if it compromises basically your mechanics of using the shoulder. Typically, a scapular strain, again, a strain is going to be pulled to the scapular muscles. So it typically will heal a little bit better, and it might not fully affect the shoulder, but a lot of it, again, depends on if your posture is compromised and it affects the way that you're actually utilizing the shoulder. If you're altering your normal mechanics, then it could affect the shoulder. Okay. Did that answer your question Okay, number one key element, no two patients are exactly the same. So it's hard for diagnosis and it's hard for treatment. So we're all unique, we all have, our bodies are unique, the types of things we're doing with our bodies are unique. So that is the one very difficult part in diagnosis and treatment, is that no two patients are exactly the same, but these are the general guidelines that we go by. So that's why you have to be patient with yourself when it comes to healing. If you're not falling right within what kind of the expected norms are, just know that everything is a range because our bodies are unique. Okay, so now that was kind of our tendonitis. Now we're going to talk about lateral epicondylitis, which is the tennis elbow. Okay, again, this is an inflammatory condition. It's a soft tissue injury, and basically it's an inflammation of a whole big list of fancy muscles, which really just means your forearm wrist muscles. Now, it's important because the physical therapist or their treating provider needs to kind of know which muscles specifically are the most stressed and the most strained. But as far as your own kind of knowledge, it's really just going to be the forearm muscles that are on the top side of your forearm. The mechanism of injury is often the result of overload from occupational or recreational activities, and it may be sudden or it may be gradual. So this is a very, very common injury. Everyone's heard of it, everyone's known about it, everyone sees the braces for it, okay? But really the biggest thing with the tennis elbow is, again, that result of overload on those wrist extensor muscles. Okay, here are your signs and symptoms. So if you were kind of looking at your own condition, you might know that you've had a history of overload of your extensors and supinators. Let's say you knew you went out and you played 3 matches of tennis that day, and that's a lot more than you usually did. Okay, or you were, let's say, lifting a lot of groceries, or doing something where you were just using that wrist a lot. Okay, you'd be a little bit tender if you palpated yourself over basically the end of the muscles on that lateral epicondyle, which is basically just the bone that you feel right on the outside part of your elbow. Okay, you're going to have pain if you resist wrist extension. So if you tried to bring your hand up and you pushed against that, that would give you some discomfort because those muscles are being resisted. You might have pain with supination, which is just the turning over of your hand. So if we resisted that motion, that might feel painful. And you may even, if you wanted to do a more specific test, you might have pain with the resisted extension of the third finger. So if you tried to bring your third finger up and you tried to push down on that, and that really irritated you and you couldn't resist that much yourself, then that might be indicative of a little bit of weakness of that particular muscle. If you stretched your wrist into flexion, that might be limited and painful. So by stretching the wrist down, if that irritates you, again, that muscle might be affected. And then typically your elbow movement is full range of motion and painless, and your resisted flexion of the wrist is pain-free as well. This is more for diagnostic purposes. These would be special tests that if you came into the clinic, we would briefly run through to try to isolate it. But for yourself, it's kind of an idea that you can still move the elbow, there's nothing wrong with the elbow, then the chances are maybe the tennis elbow. If you're having some discomfort in the elbow and your elbow is stiff and you don't have full range of motion, then we would look to see if maybe there's an elbow issue going on instead of just the epicondylitis. Treatment, again, hopefully you're seeing the common theme: reduce inflammation, soft tissue massage. These would be all things that also in physical therapy we would treat. So we have certain soft tissue massage techniques we would utilize. We would instruct you and perform progressive exercises for both the flexibility and the strengthening of the wrist extensors and the forearm supinators. So again, don't get overwhelmed if you don't know which muscles those are. That's something that a physical therapist would directly work with you to help show you and teach you how to isolate those muscles. Sometimes people will use a counterforce brace, and that can be helpful to alter the biomechanical stresses of the extensor muscle origin, thereby minimizing the tension force between the tendon and epicondyle. So I get that question a lot, whether a brace is helpful. this is the reasoning, is that theoretically it's basically going to decrease that tension force. So you basically are supporting that tendon and decreasing the stress to, again, help to reduce that inflammation. It's a very